Hi guys, it's Gigi. Welcome to my hairline journey slash story slash botchedness. This is something that has literally been one of the biggest insecurities in my life for years. This is gonna be a video that's gonna be months in the works, which is really exciting because personally I like watching those kind of videos. But without further ado, let's get into it. So it all began when I got facial feminization surgery when I was 19 years old. I had a number of things done, but the hairline lowering and the brow bone shave was the biggest procedure that I had done. And honestly, I think that it made the biggest difference. I had a little ridge that I was really insecure about. I used to call it my caveman brow. I felt that it was very masculine looking on my face. So I wanted it gone and I got that done. The surgeon, I'm not saying that it was his fault. I think that he could have done a little bit of a better job with it, to be completely honest. I am happy with the results. Obviously, I'm like obsessed, like it's like so flat, but the hairline was an issue and it still is an issue. So if you aren't familiar with this procedure, basically what it is really, really graphic. They basically cut all here along your hairline. It's like an ear to ear incision. And then they take literally your face like off, like a full scary movie, like full on Jeepers Creepers saw. They take off your skull, set it back, and then sew you back up. The recovery was insane and I was really happy with the results. But before going into surgery, he let me know that it might be possible that after I'm fully healed, you know, months or a year, 2 years, whatever later, might still be visible and I might need to get hair grafting over it. So at the time, I was just really gung-ho. I was really excited to get this on the road because I was so insecure about my forehead and my hairline and all that. I kind of was just like, yeah, if I have to do that, I have to do that. It's fine. But I doubt that that will happen to me because I'm not that girl. Right after I got it done, hair started coming through the scar. I was really, really happy because I had those like little fishy baby hairs. Like I was so excited. I was like, oh my God, like he was wrong. Like I definitely don't have to get this hair shit over my scar because it's already healing. I'm killing it. But after a while, those hairs started shedding and then I really got to see my scar. And I don't even think I've ever mentioned it to you guys, which is weird because I literally talk about this all the time. You can ask any single one of my friends. Whenever I'm getting my hair blown out or like hair extensions, they see the scar. And most of the time hairstylists like won't bring it up because they don't want to be rude or whatever. But I've literally had some people been like, oh my God, can I ask you what this scar is from? You would think that I would gag, and I kind of do because I'm like, oh, I was not expecting that. But I'm actually pretty relieved when they bring it up because it's like, okay, we can just talk about it and it'll be over with. But it's really awkward when we don't bring it up and they're like putting extensions at the side of my head and I'm like, I know that they're trying to like clip around the scar. Like it's just so, it's just like plastic surgery problems times 1,056. In 1 week, I will be going in to get hairline transplant surgery. I know it's gonna be a long process because the follicles have to take and then they shed and then you start growing hair, but it's been years and years and I could not be more excited to fix what this doctor did to me. Let's forget it ever happened and let me get this gorgeous new hairline that I've been so desperately wanting. Let me zoom you in. Let's take a look at it. If you're not into this, I think it's disgusting, but I want to show this before just to document it. Let's get it with lights, camera, action, HD, my worst nightmare. Let's zoom in. So yes, right away, as you look at the top of my forehead, you can tell that there's a scar there. I didn't really conceal it as much as I do on the day-to-day just because I want to show you guys the realness. Some little spots aren't too bad, but other spots you can definitely see that it healed maybe a bit weird or maybe the stitches weren't correct, whatever, but it definitely is a scar. Like, honey, that's not anything. That's not a weird hairline. That is a scar. And then the sides of my head are where I don't think anybody has seen because I really do consistently keep this hidden. You can see that it trails from the front of my head and the top of my forehead down to kind of like a curve and then all the way down to my ear. This is where I was cut open. This was a huge part of my FFS and these are where the staples were. And I know that it might look like it hurts or it's tender, but literally it feels completely normal. It is literally just like every other part of my head. It just has this crazy scar on it. And then the other side is the same thing. Now seeing this, I'm sure you guys probably understand why I want this gone. A lot of my friends are like, oh, we don't even see it, but it is like a big, huge insecurity for me. I can't wait to get her covered with real hair. The next time you're gonna see me, it will be 1 week from now. I will have just gotten back from Tokyo. You know, I probably should be jet lagged, but I'm gonna be way too excited. So I will see you in a week.
I got a question regarding the cameraman.
Yeah.
Is this for your own personal use?
Yes.
Okay.
Just getting my hairline redone today, so, you know, doesn't happen every day.
Well, good luck to you.
Thank you.
What?
There's a lunch menu. What am I feeling? Grilled chicken pesto.
Well, let's go to montage. Then we're gonna be close.
Yeah, exactly. And then come back for lunch.
And we'll have a drink, have a special treat.
And maybe bring me
Special? Not bring me like.
a little something would maybe help me.
No, it'll thin your
It makes you
blood.
bleed more. Gigi, you're not drinking shit.
Gigi said bring
We're
me a
gonna
little
take
drink.
1 day off today.
A little drink.
Thank you. Love you.
Bye, Nick. Love you.
All right, guys. Final thoughts on my hairline?
Hate it.
I'm excited for you.
Get rid of it. Get a new one.
Nats?
It's not 10, but
I mean, I don't think you need to do it, but do whatever makes you happy.
I'm so excited to put you in a little hair bun every day.
We gotta
I'm
go to
very
Hermes
excited.
right after and get silk scarves.
No, we're going home right after.
Come on in. Alright.
I'll go.
Is it okay if we come back?
How did my flashlight turn on?
Ooh, is this what?
I was wondering where that light was coming from.
I love medical procedures.
Me too. This reminds me
Well,
of science
You're gonna have a
class.
nice Valium nap.
Oh, I
You're
want to
gonna
be
have-
out of it. I want to feel nothing.
This happens to you before any and every procedure.
Denial.
Denial, yes.
Yeah, it's stages of surge. It's like, is this happening? It's not that serious. Come in.
So, the pre-op girl will be in just a few minutes, but I just wanted to come in and chit-chat real quick.
Yes.
Lidocaine-wise, you do okay? Like the numbing medication, like at the dentist?
Oh yeah. I just like a lot.
Okay, good.
Yeah, I have
So
a
we'll
fast
make sure we do
metabolism, so I just like keep me numb,
Perfect.
and I don't want to feel anything. I'm
Of
nervous about
course.
pain.
Yeah, it's not that bad. There'll be a few injections at the beginning that you'll feel, and then we're good to go.
Okay.
Yeah.
Cool.
And we'll go slow. I'm the one that does it. We'll make sure we'll do baby steps.
Okay.
Back.
Thank you so
You
much.
bet.
I wonder how
So-
long this little moment takes back here.
Okay, wait. So what is that gonna look like? Like, are they gonna lift up some hair here?
It's like right here,
Yeah.
from what, like right here.
Okay.
And then I'll just have like a scar right here.
Yeah.
Yeah, they like take it and then like
Okay.
lock it.
No. What the fuck?
Like I put clip-ins in and then it gets
Stop.
caught in a door and then it just like rips out
Not
my
in
whole
a-
my,
not in a
my,
door.
my brain falls out.
So you guys can have a seat in the lobby and I'll call you guys when I'm
Okay.
ready. Okay?
Okie doke. See you guys when I have a new hairline.
No.
I'm just kidding. See you guys in a minute.
Oh my gosh, it's so funny.
All that being hair.
So good.
Yeah. I'm so excited.
Like I'll see you
Yeah.
next Tuesday.
The littlest forehead ever.
Just like
Like we can't even do the makeup we did yesterday because your forehead's too small.
too small.
So good.
Snatch it all.
Keep your head still for
Oh,
one
sorry.
second.
Just need that Valium.
Alrighty, so it is Valium time.
Amazing.
Our favorite time of the
Do
day.
you have any more of those Ritz with
Oh,
cheese
we
dip?
sure do.
Oh no.
It's a staycation. You get whatever you want to eat all day.
Oh, if you're
Oh.
little snacky.
I should
Yes.
come here all the time.
You've had Valium before, right?
Yes.
Are you a lightweight with it or not really?
No, not at all. I'm a heavyweight.
Do you start with 1.5 and see how that
I can do 2.
Okay.
Yeah.
10 milligrams each, too?
Absolutely, yes.
Two, okay.
Down the
Underneath your
hatch.
tongue. Oh, underneath your tongue.
Up.
Yeah, just let it dissolve first.
Okay.
Yeah, there we go. Perfect.
Under.
Love
Down
it.
the house.
Down the
Oh my god.
Stop.
Does it taste like cherry yet?
No.
Not at all?
No.
It's
Tastes
Monday,
powdery.
right? It's cherry day. Didn't taste like cherry?
Mm-mm.
I could be making that up though, but
How many stitches are gonna go back there?
one long one.
Right.
It's like a baseball stitch, right? So probably, I don't know, 47, 53, something like that.
Wow.
Do you have a lucky number or something like that?
My lucky number is 9, so I think I'd still be
maybe it'll
spewing
be
with that.
49 or 59 or something like that.
This volume's kicking my ass.
Is it working?
I feel like sharing needles with
It's hot in here though. Yeah, just
Okay.
movement too. It's like.
You want me to?
Oh my god, ew, I didn't know we had to do this. Wait, really? You're gonna shave my head? I just
No,
did
not
this.
your whole head.
Oh my god,
Just this area, but you won't know that anything's missing because you can't see back there.
what?
You're always getting your head cut open.
Well, I don't know. Oh my god.
Be all Machiavellian about it.
What's Machiavellian? Like Napoleon?
No, Machiavellian. Ends justify the means.
Oh, I've never heard that word before. That word's kicking my ass. Okay.
So just only the part we're gonna
take this part out.
Okay.
So when it's all stitched together, you're gonna have long hair and long hair. So you won't even notice.
Okay.
So you know how good you said I was at like the drawing part?
Yeah.
I'm not that good at the hair cutting part. I can? Okay.
Oh wow. Those are a beautiful undercut.
But you won't, when we're done, you won't be able to tell, I promise. So with this technique, we just sew it together and you won't even be able to tell.
Wow.
Most likely. So now we're gonna braid the hair in the back.
Ooh. I can't believe all that's gonna be hair. That's gonna be so exciting.
The next step is we're gonna do the anesthesia.
Okay.
So Special K, you're gonna jump on that one?
Sure. We do have the smiley balls to remind you that this is a happy zone, and this is a necessary part of their surgery. If at any point you get dizzy or lightheaded, just let me know. I'm going to give you little breaks in between. So you're going to feel my hand up here, and here we go. Deep breath in. Okay, halfway with this part. How does it feel?
It fucking hurts.
But you're doing great.
Thank you.
Okay, I'm going to start on this side. Good job.
Fuck. Wow, that is some good shit.
See?
Yeah, it really is numb.
People hate me at the beginning, but then as we go
I never
along,
hated you.
as we go along, they're like, well, this is good. I like this.
Fucking hurt. I'm like stress eating. At this point, I've gone through like 6 of these. The fact that I had to be awake for this is freaking me out a little bit. And I'm shaking a little bit. I just hate being awake for stuff. I could do any surgery, just put me out. Oh, I am numb back here.
Hi, baby.
Hi, babe.
Oh, I miss you already.
I miss you too. Like, just about to get the back of my head cut open.
Don't
Oh my
say it
God.
like that.
Well, what's happening?
Well, I mean, yeah, but we want you to think about they're going to take my beautiful follicles so we can move them around.
Okay, they're gonna take my beautiful follicles and move them around.
Oh, okay, cool. I like the way that's much better.
Much better, much better.
Bye.
You want me to put on your booty?
Yeah. Okay, so we're gonna start, we're just gonna test it, okay? And you'll just hear some noise, but no pain. No pressure, right?
Are you doing it?
I might be. It's coming off like butter. It's beautiful. You have a beautiful strip. Good. You okay?
Mm-hmm.
So Dr. K is making sure there's no little hairs in the suture line, so you get a great result when you heal. And you did a nice job with your scalp exercises, so the scalp's coming together nice and easy. Because you don't want any tension on the wound, you can see. How are we doing? It's always like that.
It's always.
And now you can see how hair's on hair, and how it's coming together nice and easy. So now we're gonna clean you up, turn you over, and you gotta see all the things we're doing is cool.
Okay. I got dizzy for a little bit just thinking about what you guys were doing.
You did great.
It's just when you think about it, I'm like, wow, I'm getting the back of my fucking head cut off. I want to see what's going on back there, but I also don't.
When we're done, and we'll clean it up and we'll show you.
It'll look less nasty, like less a little gruesome. Oh, could I have Gatorade? Actually, I was gonna ask for that. Doesn't that make you feel better?
Do you have a particular flavor you would care for?
No, not at all. Take whatever. Thank you.
I want a blue one.
Not for you.
I'm showing her the strip of tissue, and we're dissecting the flicker units. So we're cutting into slivers and doing it one at a time.
Wow. It's
Cool,
like a
right?
fish. Oh, that is interesting. Okay, maybe I needed to see this. I think I might be ready to see the back of my hand now.
Yeah, so now I'm gonna take a picture of the back.
Oh my goodness.
Let's see how it's hair on hair.
Yes. It looks amazing. Could we get one from further?
Yeah.
Just for my group chat with my best friends. Oh my goodness. Oh my goodness. Oh my goodness. You have to airdrop that to me. That is so cool. I was like, I just got the back of my head cut off and sewn up, and they were like, Mondays, am I right? Just another day. And then I sent them photos, and they're like, holy shit. They were not expecting it. Oh, no. I thought it was, I thought it was 10 each, and then 10 each for diamonds.
Oh, okay, that's what you mean. Yeah, okay, yeah, I think that's, we'll let them know that.
It's kind of like, sounds like or feels like styrofoam being punctured, right?
It definitely does. So weird, I can't feel a thing.
Yeah, and you'll be able to see, after I do this area, you'll be able to see kind of what it's going to look like. These are in the front, so they're going to have only one hair in each unit, in each incision.
You were counting?
She'll count. Get a nice distribution throughout your whole head.
You guys don't mind if I just like play it out loud, do you?
Oh.
Can we pick up the pace?
No, did you put Chrissy with Robin? They don't like each other.
Now you can see how the hairline is starting to form.
Yeah, you totally can.
How excited.
Oh, I'm so excited.
I am having a tough time following that. What the hell does that have to do with privacy? Nothing.
Here, wait, could the light move for 1 second just so I could see? Yeah, like that.
Do this? I tried to fix this.
Yeah. Okay, so I finished that part, and then Special K is going to hit those scars where you have your hair up. So we'll do that now in a
Just
minute.
the sides, right?
Yep. Because we got a total of 2,968 or something like that, just under 3,000.
So how do you insert the hair follicles?
So
With
we're
like
gonna do
tweezers?
one by one with jeweler's forceps. Yep.
Wow.
So what we're doing is the grafts that we took out, we took the tissue out of the back of the head in a strip, which gives us the strongest hair follicles and allows us to close the hair in the back so that there's hair on hair. And so now they're taking those grafts, and what they're doing is they use these jeweler forceps to place them gently into the incisions that I made at the appropriate angle, direction, and orientation. And that's what's going to give us a natural look with the proper distribution of the hair follicles. And what we made was nearly 3,000 incisions.
Wow. Thank you, guys. And then tomorrow we'll have a whole other moment.
Exactly.
Hair washing, instructions,
Got it.
follow up, how my night was.
Yep. Thanks, guys. Thank you. Looks great.
I'm ready for my blowout.
Okay, nice.
Oh.
The pictures that I saw were enough for me to.
Out of the corner of my eye down there, I could see a garbage. I could see all the gauze they were throwing in the garbage, and it was just like more blood.
Literally
more
making me
blood.
like sweat.
The blood's kicking.
All I heard was kicking my ass. I'm like, Gigi must be here.
Yes, how are you?
Yeah, I'm good. How are you? Look how nice and clean and pretty it looks.
I'm good. Oh, it looks clean and pretty?
Yeah.
Oh, I feel like a mess.
We're going to clean it up even more, but that looks really good.
Thank you. Fashion.
Okay, go ahead and have a seat for me, right over here. Okay, so at any time, if you need a spot, give you a break, take a breather, let me know.
Okay. Ooh, I just got chills.
Okay, you had a little bit of oozing, which is totally normal.
That sounds disgusting.
And this is just gonna help me soften up all the dry blood, okay?
Okay.
Here goes the water, okay? It's gonna be in the cold. Okay, you're gonna feel me pat a little bit, okay? Is this sensitive?
A little bit.
Is it okay though?
Yeah.
Okay. You're gonna wash your hair and your sutures, okay? Alright.
You didn't rinse the other one though.
I did.
Oh, you did?
Mm-hmm.
Oh. Alright. She's like, bitch, I've been doing this for years.
So at home, when you comb your hair, you want to do it also gentle, and you want to start from at the bottom, work your way up.
I can't see myself combing my hair, to be honest. Don't risk it. Ew. Oh my goodness, so much cleaner. Okay, well, thank you.
Alright, let me go ahead and get Dr. in here.
I just started the laser treatment, which is another 20 minutes, and then we'll be out of here. Oh, fuck, that just scratched. Okay. Hi.
No, but it would be a good option.
I just moved forward and I scratched a little bit right
Don't
there.
do that. So right there. Perfect.
Okay.
Oh.
All good, all bad.
Oh, amazing.
Yeah? I'm really happy with it. It looks a lot cleaner. I'm so happy with how round we got it.
It is really perfect.
Like, I just love how round it is. I just need to work on the swelling.
Yeah, but that's okay. Well, it looks really nice.
All thanks to you.
No, I'm happy. We got a good team. Yeah, it looks great. If you have any questions, you let me know. We got just under 3,000 grafts, so it's really cool. Yeah, it's
So fun, so much.
Yeah, so it's really packed in nicely.
Yeah, and you guys, I'm so happy about how far we went back.
Yep. And we were able to go into the scar here too.
Yeah, so happy.
Into both scars back on both sides above the ears.
Yeah.
Killed it.
So happy. Thank you. Give me a
Oh,
hug.
absolutely.
You're the best. Thank you so much.
So happy for you too.
Okay, thank you. Yay. Okay, so I'm going to be under this fabulous laser for the next 20 minutes, and then I'm going to be heading home to rest, relax, and recover. Thank you guys for following me on this part of my hairline journey. I am so happy that it's done and it's all in there and able to heal, shed, and then eventually grow out. It's been a huge insecurity of mine for years and years and years, and it's finally happened. So I just really, really appreciate you guys coming along and following the journey. Thank you, Dr. Ziering. Thank you, the team here in Beverly Hills. I could not have felt more loved and more accepted and comfortable and full of snacks, and just literally it was the best experience ever. This is only part 1 of 2 videos I will be doing for my hairline surgery journey. So in a few months I will check back in, check my growth, check my feelings, just let you guys know what's up. So that concludes this portion of the series, and until I see you guys next time, stay gorgeous.